Hi everybody, Dr. Zach here, and I want to take a little bit of time this morning to follow up on the conversation that we had a couple days ago. I posted a video about an article that I had seen that was incredibly alarming to me. It was in Ukraine. They were doing some research on the COVID vaccine. They were doing some clinical trials, and there was 15 volunteers for that particular study. Shortly after they were inoculated or vaccinated, 8 of them ended up in the hospital and 5 of them died. 4 of those were actually Ukraine soldiers. So people in the military that, my guess, were probably in fairly good health going in. In fact, it's interesting, if we look at the trials that are being conducted for vaccines, or really for any medication, is that they handpick people that they're going to use for these. They're not going to pick the people that are vulnerable, the people that are most susceptible to getting ill from whatever disease they're trying to vaccinate against. They're going to take healthy, well-rounded people with strong immune systems, because that is hopefully going to give them better outcomes toward that. But I just want to plant, again, a seed in your head that says, we're putting a lot of hope in this vaccine coming out so that we can get back to life as normal. And I came across an article today, it's actually in Forbes magazine, and this was dated June 16th. And it talks about how Apple and Google admit Ethereum app to let employees prove they've been vaccinated. So here's an app that's going to actually be able to track people's vaccinations. And the opening paragraph in this article talks about, imagine a world where 40,000 screaming fans are packed shoulder to shoulder in a stadium where their favorite teams clash in a head-to-head combat. And everyone knows that everyone else has been vaccinated against COVID-19. Businesses have opened their doors to something that resembles business as usual. Only their employees have all proved their own vaccination, as has every customer who enters the building. That's the world Civic Technologies is trying to work to build. And the company today took big steps towards making real. So what we see is that, again, we're not only painting a picture that this COVID vaccine is going to save humanity, but we're now creating a world where I can walk into a room and open up an app on my phone and find out who in there is safe and who's unsafe. And safe and unsafe is defined by whether or not you've been vaccinated. And I could go down so many different paths that talk about how we actually increase our risk of shedding a disease after we've been vaccinated, as opposed to just contracting it in the wild. I won't go down that path now, but I do want to talk about an article out of the American Academy of Pediatrics. And I think it's important for us because we have been conditioned to put so much faith and trust in the vaccines that have come out and how they have saved humanity. So this is an article, it's from the official journal of the American Academy of Pediatrics. Right? These are the guys that have endorsed the CDC vaccination schedule, where our kids get 72 different vaccines, different vaccine boosters from 16 different diseases. And that the COVID-19 is one that they're going to want to add to that. So this is the annual summary of vital statistics, trends in the health of America during the 20th century. So it goes through quite a bit, and it talks about the change of life expectancy and what happened through the 20th century, kind of what we were doing from a health perspective in the early 1900s compared to the late 1900s. And as we get towards the last page, it says, the major declines in child mortality that occurred in the first third of the 20th century have been attributable to a combination of improved socioeconomic conditions in the country and the public health strategies to protect the Americans. So that's where you kind of go, okay, we've got some strategies now that we're actually going to be working on trying to guard their health. It goes on to say these public health measures included the establishment of local health departments in nearly all of the states. State and local health departments implemented these health public measures, including water treatment, food safety, organized solid waste disposal, and public education about hygienic practices. These improvements in water and food safety and purity are linked to the major decline in diseases seen in the early years of the century. The very next paragraph says, vaccination, while first used in the 18th century, became more widely implemented in the middle part of the century. Vaccines against diphtheria, tetanus, pertussis, became available during the late 1920s, but only widely used in routine pediatric practice after World War II. Thus, vaccination does not account for the impressive declines in mortality seen in the first half of the century. And this has been reinforced over and over again with every infectious disease that's come along. And so if you look at COVID-19, they've been talking about this phenomenon called flattening the curve. And that's because diseases tend to have this bell-shaped curve that they follow. You know, we've never heard of a disease, we start seeing it, we start seeing a bunch, we start getting a lot of people sick, and then we get better and recover. Think about, here locally in Colorado, several years back, we had the West Nile disease, right? Nobody heard of it. All of a sudden we start seeing a lot of it, especially here in Boulder County, a ton, and then it starts to go away, and now it's kind of off our radar. That's happened with every disease that we've been exposed to. You can go back to typhoid, you can go back to polio, measles, all of these different things, and there's this curve. That's why there's been so much energy and attention on the curve. Now, here's where it gets interesting, is if you look at all of these diseases, they follow that whether we've had a vaccine or not. So how did we recover from West Nile when there was no vaccine for that, when we think that we recovered from measles because of the vaccine? Well, if you take a look at the bell-shaped curve for measles and the mortality rates that were going on with that, is that it was already down 99% of the death rates had dropped when the vaccine came out. And what they do is they show this curve goes here, the vaccine was implemented there, and then it goes like this. They show us this last part of the graph where we just see that very bottom part and we go, oh, look at this. We had all these measles and now they're gone because of the vaccine, and we've attributed it to measles. When the bottom line is it has to do with our lifestyle, the condition of our health. Are we living in crowded places where we're rolling around in our own waste and we're breathing toxic things into our air? Or are we getting sunshine, boosting our vitamin D levels, having social interactions, making sure we're eating quality food, making sure we're getting plenty of good pure water to drink, practicing hygiene? That's where health comes from. So again, we don't need an app that tells us who's safe and who's not safe. And that certainly isn't going to be based upon whether or not you've had your vaccines. We've got a lot of faith that they're trying to build in this COVID-19 vaccine, but I want to remind you again that we don't need it. The first video that I posted way back in January when we were starting to talk about this whole COVID-19 thing was they found a cure. And this was the 90+ percentile at that point that had already recovered from COVID-19. So recognize this, is that we see all of the numbers going up because of all the testing. We see a drop in the number of hospitalizations, a major drop in the number of deaths, and we still see that 99.9+% of the people that have tested positive at some point aren't going to die. They're going to recover because they found the cure. And this is before medication, this is before vaccines. So with that, don't forget, greater is the power that's in you than the power that's in any kind of disease. You just have to steward and take care of that. So until next time, this is Dr. Zach. I hope that this will be encouraging to you and that you can put your hope in something that's far more valid for putting your hope in than any kind of vaccine they're working on. Until next time, God bless you.